Hello everyone, my name is Kwon from Daegu Catholic University Medical Center, Department of Neurology, School of Medicine, Catholic University of Daegu, South Korea. I am here with Dr. Meungguk Park, Sport Administration Program, School of Human Sciences, Southern Illinois University, USA, to present our study, titled Meta-Analysis of Physical Exercise's Effect on Global Cognition in Patients with Neurocognitive Disorders, Roles of Exercise Dose in Geographic Regions. Physical exercise interventions have been found to have a beneficial effect on delaying cognitive decline in patients with mild cognitive impairments and Alzheimer's disease. While the health benefits of PE for patients with MCI and AD are well documented, the results regarding the optimal exercise intensity, duration, and frequency remain inconsistent. Furthermore, there is a lack of research on the roles of geographic regions and the effect of PE on cognitive functions in people with cognitive impairments. The purpose of this study was to examine the effect of PE interventions on global cognition in patients with MCI and AD using a meta-analysis of randomized controlled trials. The secondary objective was to explore the moderating roles of exercise dose in geographic region. Data analyses were performed using comprehensive meta-analysis software. The preferred reporting items for systematic reviews and meta-analyses were used in identifying and selecting studies. Criteria for inclusion: using randomized controlled trial research design, study participants clinically diagnosed with MCI and AD, implementation of a PE intervention program, measurement of global cognition outcomes, and reporting of sufficient statistical information. Search period was September to October in 2022. Of 1,362 articles reviewed, 32 RCTs met the inclusion criteria, total participants of 3,471. For data analysis, comprehensive meta-analysis software version 4 was used. The IOHSK statistic was used to measure the effect size for the difference between means. A random effect statistical model was used, and subgroup analyses were employed to examine the moderating roles of exercise dose in geographic region. For results, the average effect size across all 32 studies, effect sizes of 37, was statistically significant at p-value of 0.001. PE interventions had a moderate to large effect on global cognition in patients with MCI and AD, IOHSK equals 0.711. Kwon's guidelines for IOHSK of 0.2 indicates a small effect, 0.5 a medium, greater than 0.8 a large effect. For assessment of heterogeneity and publication bias, these studies revealed a high degree of heterogeneity, and the funnel plots showed an absence of publication bias. For PE dose, moderate intensity interventions had greater effects than low moderate, moderate high, and high intensity interventions. For PE duration, short, less than 3 months, IOHSK equals 0.627, and medium, 3 to 6 months, IOHSK equals 0.842. Interventions had greater effects than long-term periods over 6 months. For PE frequency per week, more than 3 sessions per week had a significantly greater effect on global cognition than 2 or 3 sessions per week. Next, geographic region, effect sizes were significant for Asia, Europe, and South America, but not for North America and Oceania. PE interventions were more effective for participants in Asia than those in Europe and North American countries. For conclusion and discussion, the main finding that PE exercises were effective in slowing down the progress of cognitive decline among patients with cognitive impairments is consistent with the existing literature. Possible mechanisms underlying the effect of PE on global cognition are: first, increased levels of brain-derived neurotrophic factor, BDNF, which influence learning and memory, and second, decreased beta-amyloid production and providing an increased oxygen supply to the brain. The results suggest that midterm, moderate-intensity PE interventions with more than 3 sessions per week are most beneficial for patients with MCI and AD. Given geographic differences, it is clinically significant to identify specific genetic and behavioral factors that may contribute to variations in exercise responses across populations. Thank you for listening.